Today on the show, building an oncology research pipeline to attract early career professionals. Welcome back to Cancer Buzz. I'm your host, Summer Johnson. Cancer programs nationwide are facing workforce challenges, so it's more important than ever to think outside the box when it comes to recruitment. Laura Matthews joins the show from Inova Schar Cancer to share how her team is growing their professional pipeline.
The article was written about what we call pipeline partners. And I know that our cancer program is not unique in that we are facing workforce challenges. And we know how critical it is that we have enough team members and enough trained team members to care for our patients safely. And I know that this is something that many cancer centers and cancer programs across the country are facing as well. And so we thought there was an opportunity to share some of the innovative things that we're doing to really grow that pipeline of folks, to get really early access to students who may be interested in careers in oncology, to get them looped in as early as possible. We want to be able to do that. Many of the programs that we are working on now, we're pretty early on, but we wanted to be able to share at least the ideas that we have and what we're working on with other sites in case it's helpful to them as well.
Tell us more about the pipelines that your team developed.
Sure. So the three areas, we really started out in clinical research. So as you know, clinical research is an area that is of growing importance for all of our cancer programs. And so really wanted to focus on our summer internship that our clinical research team has developed. It's a 9-week internship there to get college-age students involved in clinical research early on, even while they're still in undergrad. We also focused on lab and phlebotomy. As we know, the critical importance of lab for our patients and for our workflows, and having enough trained phlebotomists. And so really Inova creating their own Inova phlebotomy school, a 10-week program. So we highlight that. And then the third area that we highlight is in radiation oncology. So the work that we're doing both in dosimetry as well as medical physics in terms of formalized education programs for those two areas. So rad-onc clinical research and the lab as well.
If your colleagues across the country, another cancer program, is listening to this and wants to build this out, where do they start?
So one of the things that we did was we partnered with many of our local organizations. And so I would encourage any other cancer center who is interested in maybe building some of these programs to look within their communities for any undergrad programs, any high school programs, any community colleges that can really be great partners to them. One of the things that we have learned is that you don't have to let geography limit you. So even if there are programs, in our case, it was for dosimetry, and we are here in Northern Virginia, but we partnered with a program in Wisconsin. And so don't let geography limit you in terms of being creative about the different educational partners that you may want to work with. And I think the last thing is for anyone who's looking to replicate some of these programs, bring your creativity, bring your innovation. Many of these, if not all of these, were ideas that came from leaders and team members who saw an opportunity to better grow our workforce. And we said, you know what, let's try it. And so I think, really bringing that creativity and that excitement about building a pipeline is something that any other program would need.
What do you hope readers take away from your Oncology Issues article?
Workforce challenges can be a make or break resource in terms of our programs. And so any way that we can creatively share ideas and work together to partner with others to build programs as needed, really it's thinking outside of the box to, as I mentioned, get to folks earlier on in their career, to high school age, college age, before they're really starting to formulate exactly where they want to go. Make sure that they have an awareness of all the incredible things that they can do in oncology.
Thank you, Laura. If you want to learn more about pipeline partners, we have the full article linked in the show notes. Thank you for listening. Until next time, for the Cancer Buzz team, this is Summer Johnson.
This show is a resource of the Association of Cancer Care Centers.